Hi, everybody. Welcome to Cardinal Conversations, the podcast that introduces you to influential and important people in the field of physical medicine and rehabilitation. I'm Dr. Darryl Kaelin, Chief of PM&R and Professor at the University of Louisville. I'm here at the Annual Assembly of the American Academy of Physical Medicine and Rehabilitation, and with me today I have the distinct pleasure of having Dr. Deb Venesy. Deb, welcome to the show.
Thanks,
so good to have you.
I don't know how influential I am.
Well,
I'm grateful to be here.
She is a past president of this academy, a dear friend, and I would say a inspiration to all physiatrists, and especially the women in this field who can look up to somebody who has done so much for the field of physical medicine and rehab. Tell us a little bit about your trip to leadership in this organization and within the Cleveland Clinic where you practice. What got you interested in PM&R, and how did you get into organizational medicine and lead on to eventually becoming president?
I think, great question. Let me see if I can, how I got into PM&R. When I was a medical student, I followed some physicians in Dayton who said I needed to work with Ernie Johnson, and I had no idea who Ernie Johnson was, and he was one of our forefathers, I think,
absolutely.
at the Ohio State University.
The Mount Rushmore of PM&R, he's on it,
And ironically, before that, I did a neurology rotation at the clinic.
Oh, okay.
Which is where I work. And I thought, I'm going to be a neurologist. And I'm like, this is just, sorry, neurologist, this is so esoteric. And then I met all of these PM&R docs. I'm like, this is really cool. I'm like, what do you guys do? And I shadowed them. And then I spent time at Ohio State and worked with great people, loved it. And that's really how I got into PM&R. So it was really through Ernie. I did my residency at Ohio State. In regards to leadership, as you know, my mom was extraordinarily influential in my life, all of our lives in my family. I was the oldest of four, raised by a single parent who went back to school and really she's a nurse attorney and consummate volunteer. So that was instilled in me from when I was tiny.
Right.
And always have volunteered, always gave back. And also, so in residency, Claire Wolf.
Oh yeah, Claire is awesome.
Another Ohio State person. She would do presentations during her residency and say, you got to get involved. So I did.
Yeah,
and
that's great.
And I think the first time that I really got involved with the academy was when I came to a couple of the meetings as a resident to present at a poster. Super fun. Got to meet all these people that came and talked to, and that it was I loved it. So what could I do next? So
I think that's so important for people to hear, which is just get involved somewhere. Jump on a committee, put your work and your time in, show that you're willing to help out, and you'll start to rise through that. You'll become a committee chair, and then you can find other things to do. And for most of us, like yourself, it probably takes 20 plus years in an organization to get to the board level. And if that's something people aspire to, it's great, but it's, not everybody wants to be on the board, and that's fine. But
I'm not sure I really aspired to that.
Right.
Maybe I did. There were, but it was just great opportunities for me to meet people like you. Just simple things, and all you have to do is just answer your email.
That's right.
Sorry.
That's right.
That's really how you get involved.
And go to a meeting once a month or something for an hour, so it's nothing crazy. That's great.
Now with Zoom and stuff, I mean, it's so easy.
Well, tell me about spine care. You're a spine specialist at Cleveland Clinic. What got you interested in spine care, and kind of how did you go down that path, that career path?
So my career, I started at Ohio State. I did some inpatient work then. I ran a chronic pain rehab program.
Oh, wow.
And then I left and I did a little private practice. And part of my private practice was certainly outpatient PM&R, which is
a lot of musculoskeletal,
EMG. I did inpatient. I got recruited back to Ohio State and I was their medical director for their spine center.
Wow.
So, which meant I was really the only physiatrist that was seeing patients.
Right.
And then I worked with a bunch of surgeons, and we had great PTs and OTs. And so that's really how it started. And then somehow I got recruited up to the clinic.
Cleveland,
And stayed there. I did inpatient as well. And really, spine is really outpatient PM&R. So I've done a lot of different things but have stayed primarily in outpatient spine
Right.
function. I think I'm dating myself, but injections really weren't a thing when I was growing up.
Yeah.
I watched it, but I was like, oh, I don't feel like wearing all this stuff. I really love the therapy part.
Right.
So,
well, I'll ask you. I asked DJ Kennedy, who I met with yesterday, the same question. He's obviously more of an interventional spine guy, right? And I talked to him about some of the new innovations and changes going on in his line of spine care. How about in the non-interventional areas of spine care? Anything new and exciting on the horizon?
Probably not. I think we are very function oriented. We do therapy.
Right.
I think at the clinic, I was trying to think about this, what might be different. So in our Center for Spine Health, there are surgeons, non-surgeons, walk.
Right.
I still do EMG. That's my procedure.
Yeah.
And then we also have a pain psychology group.
Yeah, that's important.
So we have I mentioned that I ran a chronic pain program at Ohio State. Things have changed a lot, but they're also part of our spine center.
Right.
And just recently, so it's gotten like super huge. We also have the pain anesthesiologists that are all in one big happy field.
I mean, having a comprehensive pain program and spine program, that's so important.
It is, because so much of it is therapy. So actually, I'd say some of the innovative things are through the pain rehab. So they're calling it pain recovery, understanding that you can't separate the mind from the rest of us, the rest what we're doing. They offer some new cool programs virtually. They're starting some other programs pre-surgery.
Right, yeah.
Yeah, it's cool. So that's
you work in an environment and in a state, I would say there's probably no state, maybe Texas, but I think Ohio is the state where almost everybody understands what a physiatrist is. But today is Physiatry Day.
Sorry, I'm not wearing
So
my
happy
shirt.
Physiatry Day. What's your elevator speech to somebody who doesn't know what PM&R is?
We're function doctors.
Yeah, you go.
We take care of people. We're we help people functionally.
Right.
And especially like with spine intervention, they might do that to help them get to their next goal. It's not to fix anything. Yeah.
Well, and as a spine specialist who also understands and manages people with chronic pain, I always ask medical students who rotate with me, why do people go to the doctor? And here they are in medical school, and they look at me like I've got three heads, because they're like, nobody's ever asked them the question before, right? And it really comes down to disease, which is often I'm uncomfortable in some way. Could be pain, could be other things, and dysfunction, right?
Absolutely.
But medical school spends 90% of its time teaching us about how to diagnose and treat disease, and very little time spending on function.
Absolutely. And with our fellows, I always say, do not forget your PM&R roots.
Right.
Because that's all we are about.
Yeah. Right.
And what are the person's main concerns when they come in there? It might not be back pain or neck pain, it might be something else. So unless you address that, you're not going to help them.
Well, and then in that comprehensive spine model, that's where psychology and therapy are very important to help give people their own tools to work through why sometimes they have ongoing chronic pain that isn't going to get fixed with a shot or with a surgery, right? We have a tough group of patients that we take care of. We might not give them the answer that they want, but I think you're right. If tools, helping them understand what's going on, listening to them. Sometimes that's all I do. Well, a couple of fun questions. So, Deb is living in Cleveland, and we all know Cleveland is a beleaguered sports town right now.
It is, yes. And should I share that I am a Brown season ticket
holder? Oh gosh.
Holder?
Well, here's the question. This is great. You're given that. So, if you had one wish for all the sports teams in Cleveland, what would that wish be?
Can I have two?
Okay, I'll give you two.
The Browns certainly have to win the Super Bowl.
Oh my God, that is an undeliverable wish.
At some point. Yes, and they traded a more mature quarterback, Joe Flacco, to the Bengals.
Crazy.
And he did great.
Yeah, absolutely.
Anyway,
yeah.
So yes, that is one of our hope.
Yeah.
And I think the Cavs too.
Yeah.
We're now half-season ticket holders.
Yeah, what's
your
dibs on LeBron coming back before he retires?
Oh, he's not. He's not.
He's done his deal there.
He's not.
He's spent his time there.
No.
Yeah.
No. I love basketball.
Yeah. Well, so it's a great sports town. It's just they've been so unfortunate that they just can't get over the hump.
Yeah, and with the Browns, I mean, it's disheartening right now. Sorry, but they are impassioned.
Yeah.
I mean, they really. I don't know why.
So my next question, kind of a fun question. So if you were going to go on a date with your husband,
Yeah.
okay, your best date night is eating in and watching Netflix, dressing up and going to a play or show, dinner and a concert, or meeting up with friends and going dancing into the bars.
Oh my gosh. I'd say B and C.
Oh, okay, so you're
Yeah,
a dress up and show girl.
We love theater.
Yeah.
We love sports.
Yeah.
We love hikes.
Yeah.
I love to dance, but we haven't danced much.
You know, it's funny because dancing
I
is
think
kind
we're
of
gonna
not
come-
happening.
we're gonna
I hope
come-
dance places come back, right?
We're going to come back.
Yeah, yeah.
And
Hope so.
Daryl's got an open invitation to come visit.
Oh, well, thank you. I might take you up on that. So,
How about you?
Well, I think we like all those, but I definitely think my wife and I are dinner and a show kind of people.
Yeah,
We
I
like
love-
to go to dinner and then
I
go
love
to a
theater.
play or to a theater or a game or something like that. So,
yeah, we love theater and
yeah,
sports.
for sure. So as we finish up today, what advice would you give to early career physiatrists who, especially women? I think women, you know, I don't want to sound in any way chauvinistic, but I think women really need to have role models like yourself to look to, because it's, you know, we know that the road can be difficult in medicine for everybody, but it can especially be difficult for women sometimes in specialties where there are more men. What advice would you give to young career physiatrists who are wanting to not only be successful in their careers, but maybe go into leadership roles?
Talk to us. We're really easy to talk to.
Yeah.
Come find me. I do mentor a couple of our early career physicians at the clinic just to spend time and just talk to them.
Right.
I think a lot of times men too feel
Yeah.
like between family and work, it's
Yeah.
hard to do it all. Maybe sometimes we feel it a little bit harder.
Yeah.
When we're difficult, like how do you raise a family and work
Right.
and do all that? And you've got to have a great spouse.
Yeah.
In both ways,
Yeah.
so, but really, come talk with us.
Absolutely.
Yeah.
Mentorship is so important.
Yeah.
I think
I'm
everybody
happy
who
to,
I've
love
spoke
to.
to has had somebody give them words of wisdom that have helped
Yeah.
them. For me, it was Barry Smith early on in my career who really said, you know, all the leadership stuff will come, but take time and be with your family early
Yeah.
in your life. You'll regret not having done
Yeah.
it, and they'll resent you for not having been there when
Sure.
they needed you. So
Yeah.
that was probably the best advice I ever received. But speaking of talking to people, it's been a delight talking to
Oh,
you. You're always
I love
great.
Darryl.
I love you.
Yeah, I do too.
And thanks for being with us
Oh,
today.
sure.
And join us again next time on Cardinal Conversations. Good night.